I would only go with IVF with that kind of a history. I would look carefully at that fallopian tube, because if there's any obvious problem with it, I would take it out before the embryo transfer. But the first thing to do is to get the eggs, fertilize them with husband sperm, and freeze the embryos, because the eggs are your big issue. And if your eggs are getting older, then you're lowering your chance of success. So before I worry about the fallopian tube, before I worry about any of that, I would go directly to IVF. And the problem with IVF is that if the fallopian tube is damaged, even with IVF, the egg can migrate up into that fallopian tube and stick there and still be another ectopic pregnancy. So, for sure, I want to make sure that that fallopian tube doesn't show obvious signs of defect. But they don't have to be obvious. You're still at risk of an ectopic pregnancy again. I'm not in favor of saving a tube when you have an ectopic pregnancy in the tube, because you could get another ectopic even with IVF. And you really don't want to waste those precious embryos. So if we see any possibility that that tube has some residual damage, we'd want to remove it laparoscopically. But either way, IVF is the way you should go. You shouldn't be subjecting yourself to another risk of ectopic.